Good day, everyone. Today's article is titled Effect of Calcium Hydroxide as an Intracanal Medication on Dentin Fracture Resistance, a Systematic Review and a Network Meta-Analysis. It was done by Sunlakawit et al. And it was published in Journal of Endodontics in 2024. Calcium hydroxide intracanal medication is used between endodontic treatment visits to reduce the remaining intracanal bacteria due to its antibacterial effect. Multiple studies have reported high incidence of root fracture after applying calcium hydroxide as intracanal medication, and that led to the assumption that calcium hydroxide could weaken the root dentin. Many laboratory studies have been conducted to test this hypothesis with different study design. Therefore, this study aimed to perform a comprehensive systematic review and network meta-analysis to evaluate the effect of calcium hydroxide as an intracanal medication on the fracture resistance of dentin in human teeth. So they included 27 studies that met their eligibility criteria and were included in the network meta-analysis. They first assessed the risk of bias by following multiple domains. And out of the 27 studies included, 13 were graded as having a high risk of bias, 10 has a moderate risk, and 4 have a low risk of bias. The data were classified based on the duration of calcium hydroxide exposure, either 2 weeks or less, 4 weeks, 8 weeks, and more, in addition to no calcium hydroxide as a control group. As for the results, their overall results indicated a statistically significant decrease in fracture resistance when teeth were exposed to calcium hydroxide for any period compared to no exposure, and no significant difference in fracture resistance between short-term, which is 2 weeks or less, and 4 weeks of calcium hydroxide exposure, and no significant difference between 4 weeks and 8 weeks and more of calcium hydroxide exposure. However, as for their subgroup analysis, where they classified them according to root development, showed in mature teeth, calcium hydroxide exposure for 4 weeks and more significantly affected dentin resistance, and in immature teeth, no significant difference was found, except for calcium hydroxide for 4 weeks. So to discuss the results of this meta-analysis, they mentioned that the papers they included overlooked the dentin thickness, which influences tooth fracture resistance, and some failed to adequately control for moisture in extracted teeth, increasing the risk for fracture. And other studies did not perform mechanical instrumentation to the control group, in contrast to the groups which received calcium hydroxide as intracanal medication. This discrepancy predisposed the experimental group to thinner dentin and consequently a higher risk for fracture. And to conclude, within a moderate to high risk of bias, the overall result of the meta-analysis of laboratory studies indicates that medication with calcium hydroxide affects dentin fracture resistance, especially if it was placed for 4 weeks or longer. And fracture strength in immature teeth does not depend on the duration, but might be suspected to be associated with the thin root dentin as well.